Name is Vishal Bali, co-founder and chairman Medwell Ventures, which runs the Nightingales home healthcare services across the country. I'm based out of Bangalore. The home healthcare as a service delivery, as a healthcare service delivery in India is at a very nascent stage. It started actually in 2014. That's when we at Medwell Ventures started Nightingales, the home healthcare company. And so it's been 3 years, but I think the industry and the sector is evolving very quickly. There are a lot of lessons in home healthcare around the world, particularly in the US and Japan, which have been the hub for home healthcare companies. In fact, some of the largest home healthcare companies in the US are also publicly listed. So home healthcare as a sector is a very well ingrained sector in the healthcare ecosystems of many developed countries around the world. So I think from an India perspective, the next 5 to 7 years will see the entire maturity curve of the home healthcare sector. There will be many players who will come in, which is good for the sector, which is good for the consumers in this country, and which is good for the healthcare ecosystem. So I think the national healthcare policy is more a document which is talking about the maturity of the healthcare services in the country, while it does not pertain to home healthcare as a sector. But I think the fact that the national healthcare policy is talking about reach of healthcare, and home healthcare is one of the most vibrant ecosystems where people can receive healthcare services in their home, and therefore the geographical spread that you can do with home healthcare is very wide. So one can go really deep in cities by having logistic hubs where nurses and doctors and physiotherapists and other allied healthcare professionals can operate from. So I think from a national healthcare policy perspective, because it dominates the reach of healthcare, home healthcare can be a very big vehicle to achieve that goal. So I think one of the key trends that needs to be done in the home healthcare segment is not to just do the routine services. Right? The routine services are you send a doctor at home, you send a nurse at home, you send a physiotherapist at home. I term them as routine home healthcare services. There is a large component, and particularly looking at it from an India context, where chronic diseases are becoming hugely prevalent. One of the biggest impact that home healthcare can make is in the management of chronic diseases for patients at home, so that these patients don't need to go through recurrent hospitalization. And I think that is one of the biggest impacts that we can make with home healthcare. The other area that we can make a big impact with home healthcare is around aged individuals, because when you age, you obviously get into many medical complications. Now, to remain hospitalized with all those medical complications, which don't require the intensity of a hospital stay, but require the care that a hospital services can provide, those are again services that one can provide at home. I think the third big impact which is going to be made in home healthcare is the way that we are going to use technology a lot more. So in the area of remote patient monitoring, these are areas which will define the home healthcare enterprises of the future in terms of the impact that they can make both on the services side and on the technology side in providing care to patients. So as I said, that I think one of the big areas of push in home healthcare is to use more and more technology. Now, in a home healthcare environment, technology actually even starts with the way that you do logistics management, because that's where you optimize your productivity the best. So one way of the starting point of home healthcare is good logistics management. Then comes the entire technology which is used for providing clinical care. Now, starting point of that is how your point of care devices at home, the monitoring devices, can be plugged in so that they can be monitored even remotely. So that's the next technology impact, which is around the point of care devices. I think the third one, which is basically the mobile devices and how you can be monitored anywhere by your clinicians and by your paramedical staff from anywhere, is the big impact. Because particularly in the area of chronic diseases, there will be a lot more technological impact in the way home healthcare is offered to patients. And management of chronic diseases at home has a big influence through technology. So I think given by the way that particularly we at Nightingales have also grown over the last 3 years, we are now in 4 cities. Uh, we are in Bombay, we are in Bangalore, we are in Hyderabad, we are in Pune. We plan to launch in another 4 or 5 cities more. We have now close to about 1,500 people who work full-time in the company. That just goes to show that even in 2 years' time, there is a lot more impact that has got made, which effectively means that from a consumer side, the consumer has begun to accept a concept called home healthcare. So I think from that perspective, it's the beginning, but it's a very good beginning. And I think over the next 5 to 7 years, we will see a lot more impact of home healthcare within the healthcare ecosystem of India. I think it's going to be one of the pillars on which healthcare in this country will grow, basically because we have to move out of the hospital systems and make the hospitals more and more intensive care environments or surgical care environments, and the chronic diseases and patients with chronic diseases should ideally be over a period of time treated at home. Those who require intensive care should go into the hospital. So I think home health care will become a key pillar in the healthcare ecosystem of India. So I think, we give a good example of this at times. If you look at a patient who's got COPD or congestive cardiac failure, patients who are recovering from neurological strokes, and if you see the first couple of days of the patient's hospitalization, and then also look at it that if this patient was to be treated at home, how much it would cost them. So I take a small example, a patient with COPD, a 2 days or a 3-day stay of hospitalization can be for this patient a cost of say about 45 to 50,000 rupees, because the patient would have to be administered a lot of drugs, ICU care, probably they will go to the ER. The same patient on a care protocol of COPD at home with Nightingales for 1 month would be in the region of about 40,000 rupees. So I think there is a affordability quotient over here where patients can be treated more affordably at home, particularly where chronic diseases are concerned, because chronic diseases sometimes can be very repetitive and they should be ideally be treated at home.